Good morning and welcome to your Farm and Home Show. I'm Kristi Shive, and this morning we're visiting with Sarah Drysdale. She's Family and Consumer Sciences Agent in Ballard County. Good morning, Sarah.
Good morning, Kristi. How are you?
I'm doing great, and it's great to have you back on the show. Now, Sarah, November is Diabetes Awareness Month, and you are here to talk about that and everything that this month is geared towards.
Yes, so November is Diabetes Awareness Month. It is every November. And so a lot of people just kind of need a check in with Diabetes Awareness Month. Why is it important? What we need to do. So, as we know, diabetes is a disease that occurs when we can't regulate our blood glucose levels. So, some people are hyper or hypoglycemic, depending on what their type of diabetes is or their symptoms that they have. And so we just want to try to make sure everybody's aware of what they need to focus on and how they need to manage their diabetes better for themselves. And that is the most important thing, is starting with yourself.
Now, Sarah, I know that a diagnosis can feel overwhelming to yourself if you are the one receiving that diagnosis, or to a family member. So, what are some things that we can focus on?
So, one of the big things that we focus on is just focusing on that you are the center of your care. So, you know your body. And the most important thing is to always consult with your doctor, build your team of medical professionals that you need. So, consulting with those people that you need to consult with and helping with your family, but also trying to do early management if possible. So, if you have an early diagnosis, just learning ways that you can manage it that work best for you. And then, of course, we always want to talk about healthy eating and physical activity. Now, we're not talking you have to change your diet completely, but just making those mindful choices of when to substitute some things for other things, such as low fat for full fat, you know, sugar substitutes instead of having all that sugar. And then, of course, getting your daily 60 minutes of exercise a day. It doesn't have to be running a marathon, but going for a walk, doing stretches, just what you're comfortable with doing and not pushing yourself too hard.
Now, Sarah, you mentioned that 60 minutes of exercise. Do we need to get that all in at one time, or can it be broken up throughout the day?
It can be broken up throughout the day. So some people will do 30 minutes in the morning, 30 at night, or break it down into 15 minutes 4 times throughout the day. Some people really like to do their 60 minutes all at once, and that's fine, but you can break it up to however you want it to be. And it doesn't have to be anything rigorous. It can be low impact, low cardio, just going for a walk, or maybe even just doing some stretches in your chair just to really get you active and moving.
Now, Sarah, if someone is struggling to find recipes, do we have any resources that people can access through their local extension office?
Yes, so every local extension office has the nutrition education program, and those recipes are tested and true, and most of them meet the dietary restrictions and requirements for some of our diabetic clientele. So most of our recipes are very good for those.
Sarah, in addition to contacting their local extension office, are there any other websites or resources that they could go to access information?
Yes, there is the National Institute of Diabetes and Digestion and Kidney Disease website. So, this is a national organization that has everything to do with diabetes, kidney disease, digestion problems, weight management, and even diet and healthy portion nutritions for those that have these types of ailments.
Some of the biggest requests that I receive in my community when someone gets diagnosed with diabetes is just struggling to find that recipe inspiration. Eating is something that brings us joy, and so finding those recipes that still nourish our bodies but also nourish our soul.
Yes. And then, of course, if you really want to ask more questions, contacting your local health department, they can also help guide you, maybe finding some more of those healthy recipes. If you can't find them on your own, they are a fabulous resource to use.
Sarah, thank you so much for being with us today. Some really good information. November is Diabetes Awareness Month. As always, contact your local healthcare provider. If you have questions, contact your local extension office for any other questions. We'll be happy to help any way we can. Thank you so much for joining us today on the Farm and Home Show, and we'll see you next time.